The CDC estimates that 1 out of every 110 children born will be diagnosed with autism. Although that rate may sound small, keep in mind that there are approximately 11,000 babies born per year in the U.S. alone. That equates to approximately 100 babies that will be born will be diagnosed with autism. According to Autism Speaks, more children will be diagnosed with autism than childhood cancer, juvenile diabetes, and pediatric AIDS combined. Autism is a pervasive developmental disorder, and just how many are affected are unknown. It is known that boys are 3 to 4 times more likely to be affected by the disease than girls. Today I will explain the known symptoms of autism, presumed causes, and current treatment options available. Typically, the symptoms of autism will be present in children between the ages of 2 to 3 years old. The following risk factors, combined with genetic predisposition, enhance the risk of a child being born with autism. All scientists agree that genetics play a huge role in the diagnosis of autism. There are 20 genes they have found that are involved with the autism disorder. Although these genes are located all over the human genome, all of these genes are associated with brain growth, development, and cell communication within the brain. Children with a genetic mutation on chromosome 17 are 14 times more likely to be diagnosed with autism. Pregnancy in women over the age of 40 increases the risk of autism nearly 50%. That rate is higher than women who become pregnant at the age of 20 to 29 because of the genetic mutation that occurs in the sperm or egg as we age. Their environmental risks include pesticides, which are believed to interfere with the gene's development and the involvement with the central nervous system. Scientists also believe that chemicals and pesticides have adverse reactions leading to a higher effect in predisposed children, which will usually lead to the full-blown disorder. Also, mothers that are pregnant that have been treated for any type of anxiety, morning sickness, or insomnia have higher incidence rates of having a child born with autism. Vaccines are a highly debated subject when it comes to autism. That's because in 1998, Wakefield did a study with 12 children that were autistic, and in the conclusion of his study, he determined that the MMR vaccine provided a link to autism, and that there was an ingredient called thimerosal that increased the child's risk of autism. There have been several studies since then that refute his finding, but as a precaution, the FDA did remove the ingredient thimerosal from that vaccine. And also in 2011, a British journal did a study which showed that Wakefield's report was an elaborate fraud, and that he changed the medical history of several of the medical background information of the children. Some of the symptoms that autistic children will develop include communication and social. There's no case of autism that is the same, but however, the symptoms that they do develop are the same, just they can range in intensity. Typically, an infant is very social. It will smile when you smile at them, or they will laugh when you're laughing, or when you play like peekaboo with them or whatever. However, autistic children find it hard to engage in that social interaction, which will normally lead to a parent feeling that their baby isn't connected with them, or like they don't have that typical relationship with their child. Also, autistic children find it difficult to understand the feelings that we display with emotion, like faces or interpreting tone. So the parents, again, they also attribute that to feeling like the child is disconnected or doesn't understand, and sometimes believe that their children just have behavior issues. As far as communication, autistic children have no understanding of tone and expression, so it's hard for them to communicate their feelings with others. So while they may be angry, their tone may portray a different type of emotion to their parent, therefore making it more difficult to guide their children. Some children diagnosed with autism will never speak. Some will end up going to therapy and be able to say particular words and maybe form sentences. A few will develop a speech pattern or cooing, but will not normally communicate normally. Another symptom of an autistic child would be a repeat behavior. Overstimulation leads them to feel very uncomfortable in a normal environment, which then makes them act out in a repetitive nature, like maybe stacking blocks or lining up cars or anything they can do over and over and over again. And again, that's just used for comfort. Echolalia is them trying to understand their surroundings, and that's what this form of repetitive behavior is called. A lot of times they'll focus on one object to the point of obsession. For example, like I said, toy cars, trains, and again, that just gives them comfort and stability. Like I said previously, no one affected by autism has the exact same symptoms. However, they do experience some form of the symptoms. There's different treatment methods. However, everyone that has, throughout all the research I've done, they all agree that early detection is the key to properly treating autism and using the combination of behavioral therapy along with pharmaceutical drugs. There are two models in the behavioral treatment. There's the applied behavior analysis, which is founded by Skinner in 1930, and it just basically links behavior to the environment. An example of this would be like positive reinforcement. So it basically concentrates on how we learn. The next one is the Early Start Denver model. This is proven effective for children between the ages of 12 months and 48 months. And it focuses mainly on shared enjoyment in joint activities, and it has a deep parental involvement. The main difference is that the applied method treats symptoms, while the Denver model treats behavior in a social setting. As far as pharmaceuticals, a lot of children with autism experience depression and anxiety, so they're given medications to control that, as well as some violent temper tantrums that they can develop. They're also prescribed medications for that. Autism is not treated simply because every case is different. That's why early detection is very, very important, because autism is not going away. The CDC defines autism as a group of developmental disabilities which causes a sign of social, communication, and behavioral challenges. Behavioral therapy along with pharmaceutical drugs can add to the quality of life and lead to functioning adults. So while autism silences many, it doesn't lead to them losing their lives.